Hello, I'm Dr. Sophia. I'm one of the doctors here. You
Hi,
must be
doctor.
Mr. Raven Smith,
Yes, I am.
45-year-old, right?
Yes.
Is it okay if I call you Mr. Smith?
Yeah, it's okay.
Okay, so Mr. Smith, how are you doing today?
I'm actually doing pretty good. So I've had some sugar tests done a couple of days ago, some 3 month average HB something.
HbA1c.
Yeah, that's it. And they say that, it's a bit on the higher side. So I'm just concerned about that, that's the reason I'm
Yeah,
here today.
I understand. So, Mr. Smith, can you just tell me a bit more about your health condition?
Yeah, so I've had like diabetes from the past 10 years approximately,
Mhm.
and I have been prescribed some tablets to take care of it, but I've not been able to take the tablets on a regular basis, like I'm not sticking to the schedule.
May I know why?
Uh, it's like just because of my work, I have a lot of stress at work, and I also have a very unpredictable work schedule, and I also live alone, so there's nobody to even tell me to take my tablets on time. So like due to my work, I just keep like forgetting to take the tablets on time. That's the only reason.
I can totally understand, Mr. Smith. So, as you said that you have been suffering from diabetes for the last 10 years,
Yeah.
and your recent HbA1c levels, that is your 3 months glucose level, is on the higher side.
Hmm.
So, and you have not been taking your medicines, the oral medications as well.
Yeah.
So, based on all the situations, we have to switch you to the insulin, the injectable form.
What injections? Oh, no, no, no. I'm like very scared of injections.
May I know, like, why?
It's just that I'm just what do you say, like scared of needles. It like
Mm.
freaks me out. So yeah, I don't prefer injections at all.
Okay, I can understand. I can totally understand, Mr. Smith. But bringing your sugar levels under control is extremely important at this point of time, and your sugar levels are totally high. So you've not been sticking to your previous medications as well, and now we only have the option of starting you on insulin. But there are a couple of options, as you said that you don't want to go ahead with the needle. We do have another option called the insulin pump. Have you ever heard about it before?
Uh, I don't know exactly about it, but if I'm not wrong, even the insulin pump is something to do with needles, right?
Yes, absolutely. Yes, you're right. So the insulin pump also has a needle, but we won't be like we'll be pricking you only once. So you will get a prick only once, and you won't be getting the pricks like as a traditional insulin, like because in the traditional insulin we have to be pricking you regularly to provide insulin. But
Okay.
in this case, the pump automatically keeps on like sending the insulin to your body, and the needle will be pricked only once. Are you getting
Okay.
my point?
Yeah. But so like, is there any other way of treating it? Like apart from the insulin or the pump, is there any other way of like treating my
Mhm.
disease?
I completely understand your concern, Mrs. Smith, but at this point of time, your diabetes has to be controlled really well. For this, we need to stick to the insulin therapy itself. So we cannot be controlling your medication, your condition through the medicines, through the oral medication that you have been prescribed earlier. So we need to give you insulin, and as you said, that there's nobody. With you to take care about all these things. So
Yes.
I would like to like suggest some specialist diabetic nurses so that they can help you with this. They can guide you and assist you with taking this insulin and also with the pump as well, if that's okay with you.
Okay.
And also at this point, like can I just explain you a bit more about this diabetes and also its complications and how important it is for you at this time to have your diabetes under control?
Okay.
So diabetes, what mainly it does is like it affects, if it's not under control, it affects the nerve cables of your eyes. It can damage your kidneys, and it will also damage the nerve channels of your legs. So there's like high chances that you will not feel, you'll have like less sensation, and there are chances of you getting hit or like getting a prick and you won't notice it, and there's like high chance of you getting some wound which would be like very far infected very soon. And also this diabetes, it impairs your defense system, and that is the reason why the wound healing will also take a longer time than in a normal population. And this diabetes, if it's not under control, it can also cause heart attack and also blocks the channels, the blood channels of your brain, and leads to stroke.
What? Heart attack? Oh my God. Am I going to die?
I'm really sorry that you feel it that way, Mr. Smith. But if your sugar levels are not brought under control well, and if it's you're not sticking to your medications properly, there is high risk that any of these things can occur to you. I'm really sorry to be saying this.
Okay.
That's the whole point that I want to tell you, that you need to stick to the medications properly and you have to take it regularly. You need to monitor your sugar levels and it has to be under control. Only then these symptoms can we can like control all the complications that can occur because of diabetes. Are you
Okay.
understanding?
Yes, yes. I do understand.
So, Mr. Smith, can I ask you a bit more personal questions if that's okay?
Yeah, it's okay.
Do you smoke?
Yeah, like occasionally.
How about alcohol?
Yeah, I do take alcohol on the weekends.
Okay, so I would highly suggest you to cut down on your smoking and also stop alcohol consumption, because these things can also hamper in your sugar regulation as well. So if you
Okay.
need any assistance, I can like suggest some smoking cessation clinic for you. They'll help you out in this.
Okay.
All right. And also, I want to stress you more on your lifestyle modifications. You have to start working out a little bit. Physical activity is very important, and also you have to have a proper stress management. As you said that you have been having a lot of stress at work,
Yeah, yeah.
so you need to have a proper stress management as well to have a good control of your diabetes, and you should start working out as well. And I will also refer you to a dietitian so that you can get a proper diet chart and you can follow a good diet.
Okay.
These modifications are highly important. I can even suggest some social support groups so that you can take some benefit out of the social support groups as well.
Okay.
Okay. And also, as I said, I'll be like referring you to some specialist diabetic nurses so that they'll be guiding you with this.
Okay.
All right. So I again want to like stress you that your diabetes control is extremely important right now, and you need to stick to the management plan that will be giving it to you. You need to take your medications regularly. All right.
Okay.
So
Yeah,
that
doctor.
we can like prevent you from all these possible complications that can happen to you.
Okay.
Okay. So for your further reference, I'll be like providing you some leaflets and brochures so that you can read about diabetes and also about the possible treatment options that we have. And you can get an idea about that. Is
Okay.
that okay?
Yeah, it's okay.
Okay. Is there any other concerns that you have?
No, doctor, that's all. Thank you very much for like what is it telling me, and I'll try to like become a bit healthier, stop my smoking and drinking.
Yes, that's
Yeah.
extremely important, Mr. Smith, and I hope that our conversation was useful for you. And if you have any doubts, and if you ever feel faint or dizzy or any sweatings, or if you feel any nausea, then you can get back to us immediately.
Mm-hmm.
And you need to keep monitoring your sugar levels regularly. And
Mm-hmm.
also, if you have any doubts, you can always come back to us, and we'll be there to help you out.
Okay,
Okay?
sure, yeah.
Any other concerns?
No, that's all, doctor. Thank you very much.
Thank you. Hello, everyone. Let's talk about the structured approach for counseling a patient with uncontrolled diabetes and high HbA1c. Number one, introduction. Begin by introducing yourself clearly. State your name and role. Number two, confirm patient identity. Verify the patient's name, age, ensure you're speaking to the right person. Number three, assess patient's understanding. Ask the patient what they already know about their diabetes and current control. This helps you to tailor your explanation to their level of understanding, build rapport and trust, also to calm yourself and patient before moving into complex discussions. Number four, explore barriers and challenges. Acknowledge that managing diabetes and taking insulin can be difficult. Explore reasons for non adherence, such as fear of injections or pain, busy lifestyle, emotional stress, or burnout. Be empathetic and supportive, showing genuine concern for their struggles. Explain the importance of glycemic control. Emphasize why it is vital to maintain good blood sugar control. It prevents complications, example, eye, kidney, nerve, and heart problems. Improves energy, well being, and quality of life. Explain that irregular insulin use or persistently high sugars can lead to serious and potentially life threatening complications. Number 6, discuss treatment options and support. Acknowledge that insulin therapy can be challenging. Offer alternatives or aids, for example, insulin pump therapy, as it provides continuous delivery with fewer injections. Needle phobia support. Involve a relative or friend who can be trained to assist with injections. Reassure the patient that the healthcare team will support them in finding the most comfortable and practical option. Number 7, plan follow up and specialist input. Arrange a follow up appointment with the endocrinologist or diabetes specialist nurse to review progress and adjust treatment as needed. Number 8, involve the patient in decision making. Encourage shared decision making. Ask the patient for their thoughts about this new treatment option. Respect their preferences and concerns. Ensure they feel heard and involved in their care plan. Number 9, provide resources and emergency contacts. Give the patient educational leaflets about diabetes management, contact details of the specialist diabetes nurse or clinic for queries or emergencies. Number 10, demonstrate empathy and support throughout the consultation. Be empathetic, patient, and non judgmental. Validate their feelings and challenges. Reinforce that you and the healthcare team are there to support them through their journey toward better control. Thank you. Hope you enjoyed this communication encounter. Lots of love from Astrocyte Academy to you all. Bye.